Hey everybody, welcome today. Glad to have you here. Super excited that you're going to be joining us here today for this Medicare webinar. I'm Ryan Steinert. Before we get too much in the weeds here, just want to kind of take a minute. If you've got some paper and a pen handy, I'd like you to grab some of that. I want you to jot down some notes. Going to be giving you a lot of information here today. Love for you to take notes on this so you can have all the information at your fingertips so we can help you make the right decisions for you. So number one, have some pen and paper. Second thing is you're going to see a calendar down there at the bottom. I get it. I know everybody's busy. We got a lot of things going on in life. If you've got something going on, you got to head out a little bit early. Just grab that calendar. You can schedule an appointment with us and we can do a one-on-one later on. So we're going to go ahead and jump in here. I'm going to make myself a little bit smaller, go hide in the corner. So again, everybody, my name is Ryan Steinert and I am a husband and father first and foremost. Here's my wife, 6 kiddos. Yes, you heard that right. 6 kids with 1 son-in-law. Over here, you've got my brother, Rob. He works with me every day in my business, integral part of my business. He is the taller, better looking brother. I am the shorter, smarter brother. That's okay. We all have our talents. I am the founder of Your Medicare Helper. I am a Medicare and retirement expert. And I'm actually a former Medicare biller for skilled nursing facilities. And I kind of want to chat about that briefly here for a second because it was really that experience, all the confusion, questions, misinformation about Medicare that made me decide to do this. From 2007 to 2014, room and boards, meds, therapies was about 500 people a month. And I did all that Medicare billing. And you know, when somebody would come into a skilled nursing facility, usually it was for the first time. Usually it was in crisis mode. And they'd say something like, I don't know what I have. I hope I'm covered. Or, gee, I think I've got Medicare. I'm good, right? And I realized very quickly how confusing and complicated all this Medicare stuff is. And so about 10 years ago, I opened up my own company really to educate, to help inform people about the nuances of Medicare, not only the plans themselves, but really on the back end, the functionality and how they pay. So I am a broker, work in multiple states doing Medicare, currently in about 22 states doing all this Medicare stuff. So here's a little snapshot of us at the office. There's Rob and I again. You can see us there with some clients. Just kind of want to let you know, feel free to Google us, check us out. We're currently sitting at about 600 5-star reviews. Again, we focus a lot on digital in-person learning. We do have physical offices in Arizona and Idaho. So before we get too far in this Medicare stuff, also want to let you know right up front, we charge 0 fees anytime, all the time to help you out. We just want to become your agent and your advocate on this Medicare journey for as long as you may want us to be your agent and your advocate on this Medicare journey. How we get paid, should you enroll in a product through us, then those companies, those carriers, they pay us a commission directly. You don't pay us anything. Again, we're just there to work for you. And lastly, we cannot inflate the prices of these products. Once you decide what you want to do, the path you want to go, you're going to pay whatever it is that you're going to pay, whether you use us, do this on your own, or use somebody else. So let's kind of jump in here. First off, Medicare is always effective the first day of the month of your 65th birthday. Okay, so if I were turning 65 in June, I'm actually going to be 52 here this month, but if I were turning 65, Medicare would be effective June 1st. And when you want to kind of sign up for all this is typically in your initial window to Medicare, which is the month of your 65th, 3 months before and 3 months after. So if you want everything to be effective by the first day of the month, June 1st in my example, then you'd want to be doing things as of March, because you got March 1, March, April, May, leading up to June. You can always make changes every year during the annual enrollment period, October 15th to December 7th. So when we talk about enrolling, first thing I want to jump into really is there's kind of 3 different scenarios with Social Security right now, and everybody should fall into one of these scenarios. You're either currently receiving your Social Security benefits, you're not receiving your Social Security benefit, or you are actively employed and covered with insurance from your employer. So let's talk about these here real quick. If you are taking taking your Social Security right now, you will automatically be enrolled in Medicare A and B. The government's going to mail you your fancy schmancy red, white, and blue Medicare card in the mail with your unique Medicare number on that. You're actually going to get that when your window begins. So again, if that were me, we'd be getting that at around the beginning of March, maybe even the end of February. Okay. And the Medicare Part B premiums that we'll talk about more in a minute, those are going to come directly out of your Social Security deposit. Now, if you're not taking your Social Security at the moment, nobody enrolls you in Medicare. You've got to do that yourself. Now, we actually enroll in Medicare on the Social Security website, not the Medicare website. That would be too easy. So you hop on. If you've never created an account, you create an account on ssa.gov. That's going to be the easiest way to do it. There are multiple ways to do it. You can do it over the phone. You can do it at a local office. You can even mail an application into the Social Security office. We do have a free PDF document that we're happy to send you on how to enroll in Medicare A and B, where we took screenshots and everything like that. Hey, shoot me an email. Happy to get that out to you so you'll know how to enroll step by step in Medicare A and B. Okay. And the third option, if you are currently working with insurance from an employer, then we really got to have that one-on-one deeper conversation, because you've got options. You could stay on your employer's insurance, maybe just only enroll in Medicare Part A and do all the other stuff later. Or you could continue to work with your employer, but get off of the employer insurance and go full Medicare at 65. But in those situations, we really want to dive deep on cost, coverage. So we really want to sit down on a one-on-one basis and talk about that, which we're happy to do that with you. Okay, so original Medicare A and B. So this is kind of the foundation if we're building a house here. Whatever we do with Medicare, we've got to have Medicare A and B, and then there's other options from there. So Medicare Part A, most everybody's probably heard of or familiar with. This is your hospital or inpatient coverage, and we typically do not pay a monthly premium for that. Medicare Part B are doctor visits, specialists, ologists, therapy, blood work, lab work. All of your outpatient services get billed to Medicare Part B. Now, everybody pays a premium for Medicare Part B. This is income-based and income-driven. This year in 2025, the lowest amount that anybody pays is $185 a month. Could be a little more based on your scenario. And again, this is what we would chat about in a one-on-one situation. Now, there are some major exposures right off the bat that we want to let you know, because you could just have Medicare A and B, not do anything else. Absolutely. This is all optional, all up to you. But right off the bat, if all you have is Medicare Part A, every benefit period that you go into a hospital, which is every 60 days, you're going to immediately have a nearly $1,700 deductible that you have to pay, plus 20% of the tab's going to come your way. Now, on doctor visits, Part B stuff, deductible is only $257 for the year, much better than $1,700. But again, you've got 20% of that co-insurance, and there is no limit on that. That would be hitting you as well. So this is why people choose other paths and other options with their Medicare. In fact, here are those options. So you've got Medicare A and B, kind of either way you go. One path, one option is you can have original Medicare through the government, which will cover 80% of those things we just talked about. You can add a supplement or gap plan for the remaining 20%, get a Part D prescription drug plan, or you can have what's called a Medicare Advantage plan. Now, a Medicare Advantage plan will combine the benefits of A and B, okay? But this works very differently. It's not an 80-20. You pay copays for different things. You do often get your drug coverage included in there. But I want you guys to understand at this point is these are two totally different ways to go. They work and function very differently. We're going to kind of give you a high-level overview on why they're different, how they're different in just a minute. But I do want you to understand that these guys are indeed very different ways to go. As you're coming on to 65 and every year in the open enrollment period, you're going to continue to get inundated with letters and emails and phone calls about all this stuff. So the quicker you understand that these are two separate ways to go, you really cannot combine these guys, the easier it is to get your head around all this Medicare stuff. All right? Now, let's kind of talk about these guys in a little bit more detail here. So again, we have to have Medicare A and B either way we go. Okay? So the $185 a month, we're paying that either way we go. So on option one, original Medicare with a supplement plan. So with original Medicare, there is no network. This is not an HMO. This is not a PPO. You can see any doctor, any provider in the U.S. that's contracted with Medicare that accepts original Medicare as a payer source, which is 97% of providers in the U.S. Okay, the government's managing your Medicare benefit. They're in charge. Okay. you're going to have the lowest out-of-pocket cost on the back end. So depending on the route you go with a particular supplement plan, your maximum annual out-of-pocket might be that $257 deductible, and that's it. And you're virtually 100% covered after that. You do have to have a separate Part D drug plan for prescription medications, so that's an additional policy on this path. But the beauty of option one, no network, you can see anybody you want that accepts original Medicare, no referrals, no authorizations, simple, easy to use, very little cost on the back end. Okay? Option two, Medicare Advantage plans. So with Medicare Advantage plans, these are all HMOs or PPOs. It's all part of a managed care network. So now we're back to the in-network, out-of-network. Does my doctor take it? Do they like it? A lot of times you may run into issues with those coverages, with providers liking those, because now a private insurance company is managing your Medicare, not the federal government anymore. So different carriers are now running that, okay? You're also going to have higher out-of-pocket costs and more responsibility on the back end. So you need to be aware of that. There's co-pays, co-insurances, deductibles, things like that. You do often get your Part D drug plan included, and you may get some other little benefits like gym memberships and other things like that. However, that maximum out of pocket could be as high as the federal limit, which this year is $9,300 for the year. So this is where we want you to be grabbing that piece of paper, maybe making those columns here, kind of taking some good notes on these here, because again, in summary, really fast, option one, original Medicare and a supplement, jot down, no network, can see anybody you want, lowest out-of-pocket cost on the back end, simple, easy. Option two, Medicare Advantage, managed care network, all HMOs, PPOs. You're going to have higher out-of-pocket costs on the back end, okay? And lots of referrals and authorizations required. So while we're talking about original Medicare, there's also some exposures right off the bat that we want to make you aware of that are not covered as well or not covered at all with original Medicare. So first thing I want to talk about is home health skilled nursing. You know, home health, whether you fall off a ladder, you have to have knee surgery, you have stroke, heart attack, you get cancer. Usually the first thing we want to do is have somebody come into the house, somebody come in and help us out. We typically don't wake up every day and say, hey, I want to go to a facility. Medicare's coverage very little with home health, typically about 3 days a week, 30 minutes a pop is all you're going to get. And this is if you're getting physical, occupational, speech therapy, or different types of wound care. If you just want somebody to come in, palliative, comfort care, help move, transfer, toilet, bathe, those activities of daily living, respite type care, Medicare doesn't cover any of that. And the next step from there is if we end up in an assisted living or independent living facility, Medicare doesn't cover any of that. And the next step might be a skilled nursing facility. Well, Medicare covers up to 100 days in a skilled nursing facility, yes, but after day 100, you're paying privately. You're paying on your own. And take it from my experience, that's not a fun place to be. So there's some great options we have there, some great short-term care recovery plans we have for that. Also, we recommend cancer, stroke, heart attack plans to everybody we talk to, everybody we meet. There's definitely going to be out-of-pocket expenses you're not thinking of if you have any one of these big three diagnoses. Also, we're discovering this year that a lot of Medicare drug plans are not covering medications very well for these big exposures. So again, we recommend the cancer, stroke, heart attack with everybody. I can talk about that from experience. Here's my mom over here. She passed away in 2020 from cervical cancer. That's us, my wife, some of my kiddos there. You know, again, you're going to have expenses that you're not realizing that Medicare just doesn't cover with some of these big things. Again, skilled nursing, we kind of talked about the first 20 days. Medicare covers, Medicare Advantage covers, but after 20 days, there's a copay that only supplement plans would cover. If you have that supplement plan, if you have Medicare Advantage, they don't cover that at all. And again, after day 100, all costs come to you. This comes right out of the Medicare new handbook. You also have to have a 3 consecutive night hospital stay and have authorization to go, which a lot of people are not aware of a lot of these nuances. So we've got some great policy pack coverage options for you that will eliminate all of these major exposures, things that will fit every budget and every need. And we'll talk about those individually on your one-on-one appointments. So again, now we're going to go down the path, original Medicare, supplement, and a drug plan. So the best time to enroll in a supplement plan is in your initial window to Medicare. Why? Because typically you're only a guarantee issue for a supplement plan to Medicare, meaning your health does not matter, usually one time in your life, depending on the state you live in, and that is when you get Medicare Part B for the first time in your life. You've got 6 months to get whatever supplement plan you want from whatever carrier you want. Nobody asks you any health questions, guaranteed to get it. But after that 6 months, you may be subject to underwriting approvals, and rates could be a little bit higher, things like that. So you kind of want to avoid those mistakes. A couple other things about supplement plans you want to be aware of. Coverage follows the plan letter. Everything with Medicare is letters, and the coverage on a particular plan, the coverage is exactly the same no matter what company or carrier you go with, but cost can vary, cost can be different. So the plan that covers the most coverage available to you today is Supplement Plan G. G as in great. G covers the 20% in full that Medicare A and B does not cover, less that small Part B deductible, which in 2025, again, $257 for the year. So if you have Medicare A and B and a G supplement plan, your only out-of-pocket cost is going to be that $257 deductible. Coverage is the same regardless of the carrier. Cost can vary depending on the state you're in. This is going to be between $100 and $200 a month for that type of coverage on a supplement plan G. Now, there are other supplement plan letters out there. Just understand that G is the most coverage you can have today. If you want to talk about having supplement plans that are less expensive to help fit budgets, we can certainly chat about that in a one-on-one, but you are going to sacrifice some coverage in there. You need to be aware of that. So for prescription drug coverage, here's kind of our process. Here's what we do. If you work with us, we hop on the Medicare.gov website together. We're going to plug in all your medications, name, dosage, quantity, in the zip code area where you live, and it's going to kind of spit out all these plans for us to look at. We're going to talk about deductibles. We're going to talk about tier levels. We're going to talk about pharmacies. We're going to talk about copays. We're going to talk about everything with you. We're going to find the best, i.e. usually least expensive plan for you. And we're going to do that, get that set up right when you come on to Medicare at 65 or when you retire. And then every year during the open enrollment period, October 15th to December 7th, which you're going to get very familiar with these dates as you get older, this is the one time a year that you can change the drug plan if you want. So if you work with us, we're going to get back together with you every fall, Zoom call, phone call, physical appointment, and we're going to review those options with you every year because the best plan for you in 2025 may not be the best option for you in 2026, so forth and so on. A lot of people say, do I have to get a drug plan at 65? No, you don't have to. But similarly to Medicare Part B, if you do not enroll in a Part D drug plan in your initial window to Medicare, and you decide later in life you want a drug plan, then the government nicely assesses you a late enrollment penalty. The longer you wait, the higher the penalty becomes. And once it's assessed on a monthly basis, and it never ever goes away for the rest of your life. It's a forever penalty, not a one-time penalty. Isn't that lovely? Okay, so we recommend to pretty much everybody, hey, even if you don't take any medications, there may be $0 drug plans, $5, $10 drug plans available in your area. We counsel everybody to lock in on a drug plan now. You avoid those late enrollment penalties. And again, we can always review that every year during the annual enrollment period. So again, we kind of talked about original Medicare. Part A doesn't cost anything. Here's your recap. Grab your paper and pen, make some notes right there for you. Part A costs nothing. Part B, $185 a month for most of us. Might be more depending on your situation. We talked about supplement plans. G plan is going to be the most coverage you can get. And we talked about prescription drug plans, which can vary in cost, can be as little as nothing a month, and then they go up from there. So I'm going to switch gears on you now a little bit, talk about Medicare Advantage plans. So Medicare Advantage plans, again, you still have Medicare A and B, but rather than the government managing your Medicare, now it's a private insurance company. Again, these are typically all HMOs or PPOs, so we're kind of back to the in-network, out-of-network. Does my doctor take it? Do they like it? You do often get your drug coverage included with an Advantage plan. These can be very low, even zero premium Advantage plans available in your area. Could be $30, $40, $50, $100 a month, but many areas of the country have $0 Advantage plans. You still got to pay that Medicare Part B premium. Again, keep that in mind. You're always paying that Part B premium no matter what. And again, over here, you got that more responsibility on the back end. So going to have copays for every service. Every time you go to a doctor, specialist, ologist, you end up in the hospital, could be around $300, $350 a day copay. Co-insurance, out-of-pocket maximums. So you need to be aware of those things. In order to choose the right Advantage plan, we're going to sit down one-on-one with you. We got to look at doctors, hospitals, medications to take, look at the plans available in your area so we can get you the right plan there. But similarly, again, there are some exposures on Advantage plans. Again, if you go in the hospital, average copay might be $350 a day. If you end up with a major diagnosis like cancer, you're going to have 20% of chemotherapy exposure that Advantage plans don't cover, and you might have some high out-of-pocket costs. So again, we got to look at policy packs. They're going to help eliminate all of these major exposures for you. We've got policy pack 1, 2, and 3. That can cover everything: cancer, stroke, heart attack, all that's covered for you. Dental, vision things, recovery care that we talked about, home health, skilled nursing, and all that for you. So again, you typically want to sign up in your initial window to Medicare, okay, which is going to be 3 months before the month of you turning 65 and or when you retire. And then we can always review and evaluate those every year during the annual enrollment period. So back in summary, you've got your 2 plans. Again, option 1, no network, see anybody you want that takes original Medicare, less out-of-pocket costs on the back end. Option 2, going to be all HMOs, PPO, managed care network, higher out-of-pocket cost on the back end. In a nutshell, in a simple way, that's the difference between those. So, hey, really appreciate you being on here today. We want you to grab that calendar below. You schedule an appointment with Rob or myself so we can really dive deep specifically on your one-on-one situation. So hope this has been helpful, beneficial. We appreciate you being here with us today. Have a great day. Take care, guys. Bye-bye.